As CML therapy responses started to roll in over the last 15 years, I think we had different eras. We had the era of, wow, TKI therapy really can control CML exquisitely well, to, wow, it can put patients into a degree of remission we've really never seen before with any other therapies, to now the era we're in, where we're starting to ask, can a patient be in a type of remission that could be sustainable without treatment? And we have a bit of a paradox in that we may have exquisite control over CML, but we may not be eradicating it. And that's a hard notion to reconcile with cure of cancer, but I think what we're talking about is maybe a functional cure. It appears from multiple different studies that if patients have good response to therapy without any degree of relapse or progression events, particularly if they have lower risk disease at presentation, have a period of time in a deep molecular remission, and I'm being vague, and I'm not saying that they have to have a certain level of remission for a certain number of years, but if you take all those favorable characteristics and apply them to the data we have available, it appears that on average about half the patients under those circumstances may interrupt TKI therapy and not have significant relapse. And so many quantifiers there. We define success for a patient if they're thinking, or this notion of stopping therapy is being proposed. That's a successful experiment if the patient can maintain a molecular remission. They don't have to maintain exactly the same remission they were in, but we feel that if they don't have any significant proliferation in their CML, and we can watch them for a long enough period of time and see that that's still the case, they may be safe and not need to restart TKIs and may hopefully not have later relapse.